I've been using lasers in dentistry for the last 20 years, and I specialize in soft and hard tissue procedures with different kinds of lasers. And for the last 3-4 years, I've been using mainly the LiteTouch LBM laser. In some patients, usually female, the smile is so high that you see more of the soft tissue than you want to. With the laser, you can change the contour of the smile and make it more symmetrical and more natural looking. We are using the LBM laser to recontour the soft tissue around the teeth and to create more symmetrical and more natural smiles. In most cases, there is no need for local anesthetic because the laser is working without pain, mainly in the moist areas of the soft tissue. The healing is usually uneventful, and the mobility is very, very low, so the patients can walk around immediately after the surgery without any kind of a dressing on the soft tissues. They can smile, they can eat, they can perform all their daily functions completely normally. For the doctor, the procedure is very easy. The power settings are around 250 to 300 millijoules with frequency of 12 to 15 Hertz. As you see in the film, the procedure is performed using the LiteTouch LBM laser and manipulating the handpiece along the free gingiva to recontour and reshape the soft tissue. Melanin pigmentation is something that is very prevalent in dark-skinned people, and it's very easy to remove it using the laser. Alternative ways of removing melanin pigmentation is using a scalpel, which is very morbid and painful. The procedure you'll see now is a removal of soft tissue pigmentation on the gingiva, mainly in dark-skinned people. In this case, we'll see a young girl with the pigmentation on the upper anterior gingiva. Pigmentation is a melanin pigmentation that appears on the soft tissues of the mouth, specifically the gums, usually in dark-skinned people. Without the laser, the removal of such a pigmentation is a major procedure that involves cutting, suturing, inflammation, edema, and so forth. With the laser, the procedure is painless in most cases. It doesn't need any local anesthesia. It's performed in 1 to 2 visits, usually with a minimal amount of bleeding. No need for cutting and exposing the soft tissue, and no need for suturing. The process takes around 7 days to heal and to be ready for the second stage, which is removal of all that's left of the pigmented cells. And anyway, during the healing, the contours of the soft tissues are smooth and not jagged, and there is no need for any kind of a dressing. There is a procedure to remove small creases around the mouth using the LBM laser, specifically the LiteTouch. The technique is to go over the crease, either in the small diagonal incisions or along the crease, using the beam at a very low power setting, using the static handpiece with no water. And the philosophy behind the procedure is that we want to create a heat damage, and then during the healing of the heat damage, we'll have contraction of the crease, and thus the crease will disappear. The procedure using the laser, as opposed to a conventional method using a scalpel, is less morbid, does not hurt as much, the healing is better, and there is no scar formation. Usually during the administration of the anesthetic, it's advisable to put on some local topical anesthetic and then to give an injection.